So Cortney Price is going to be presenting Stop Touching Your Face, how behavioral insights are informing responses to COVID-19 and antimicrobial resistance. So Cortney is a behavioral scientist here at FAO. He has been providing international development consulting services since 2005, specializing in risk communication since 2014, and behavioral science since 2018. He is currently leading the behavior change components of 2 FAO projects on antimicrobial resistance. So over to you, Cortney.
Okay. Well, thanks again, Lindsay and Catherine and all the organizers and for having me. It's an honor to be part of Digital Innovation Wednesday and contribute some thoughts on these interesting subjects and try to contribute to the ongoing conversation of how we make our communication and perhaps even our non-communication efforts more effective. So before we jump into COVID, just a quick reflection for all of us. How powerful is human reason? How much stake do we place in our ability to harness and use knowledge for our own benefit? Well, if you take a look at FAO's work as the largest UN technical agency amassing and disseminating knowledge since 1945, I would say that our answer is probably that at least FAO corporately believes a very great deal that humans are rational, or at least, that they can be influenced by rational argument. And so we'll get into that a little bit more. This is a bigger picture idea I'd like us to keep in our minds as we go forward in this presentation. So let's jump right into the face-touching conundrum, and we'll hear directly from some experts who are struggling with it themselves.
Start working on not touching your face, because one main way viruses spread is when you touch your own mouth, nose, or eyes. And of course, enhanced cleaning of surfaces.
I've been looking around the room here. I can't tell you the number of you who've put your hands to your face in the last 20 minutes or half an hour.
I want to know how many of them are from...
Don't touch your face. My kids are so sick and tired of me saying if they scratch their face, don't touch your face.
Okay, well, I guess our first question that pops to mind is, why can't these officials follow their own advice? Now that seems like a fair question at first, but perhaps if we try to look at it behaviorally, it's more fair to ask, how automatic is this behavior? How hard is it to stop? Now I'm going to ignore whether it's the right behavior to stop or there are other behaviors we should focus on, just because officials have said this mantra, stop touching your face. So let's assume for all intents and purposes that we really need to stop touching our faces. How do we go about it? How many times do we touch our face per hour, do you think? 5, 10, 15? Most studies show actually between 10 and 20. And some really interesting studies show that the disease experts touch their faces more often. So what's going on? Well, this isn't a neurological explanation, but it's a system or system theory that's been very helpful to behavioral science over the years. The dual process or dual system theory could help us understand what's going on. It's a useful rubric for understanding behavior, where system 2 is Spock over here on our right, is our rational, logical side that engages in most of our deliberative thinking, where system 1, depicted by Homer on the left, is our non-conscious decision-making or automatic actions. Looking at it, the problem in terms of these two systems, we need to realize that perhaps, we're not only Spock, but we're also Homer. We're not as logical as we think, but we need to also realize that our two systems are not equal. They're not created equal. Actually, system 1 is a lot stronger and more persistent than system 2. System 2 is actually quite weak and quite lazy. This is a very generic and crash course in this idea, so in a few minutes we're not going to get into too many details, but it's an interesting idea and helpful to understand what's happening. Many factors are beyond our direct control, and much of our behavior is automatic, no matter what we think about it. So what's the solution? Well, information dissemination is a common approach. We see here a leaflet from Ireland, displayed in their public transit system, giving people the facts about the risk and helping them understand what they should and shouldn't do. This evidence-based precaution advocacy, as it might be called, is standard. Another voice I heard from last night after I was involved in avian influenza a long time ago and met Dennis Carroll a few times, but you might be familiar with Dennis Carroll from their latest pandemic miniseries on Netflix. He said last night in a webinar by the National Smithsonian that we will never have to live through another pandemic because we have all the knowledge we need. He said we should never have to live through this again because knowledge is power. Now, I'm not disagreeing with him, but I'm wondering that maybe that's a better question. Not is knowledge power, but does knowledge empower better behavior? And the results are mixed, actually. Knowledge is often not enough, especially when we're considering automatic or irrational behaviors. Those that are hard to control. There's plenty of research showing that if you put a handful of chips or potato crisps in a bowl, you'll eat less than if you eat directly from the bag. This is not rational or logical, it's just automatic. So how do we address our automatic side? Well, we identify trigger points where the behavior is likely to happen, and we try to change the context. If you can't change your mind, change the context, physical, social, or cognitive. Essentially, the basic premise of behavioral science is if you want someone to do something, make it easy. If you don't want them to do it, make it hard. And surprisingly enough, so much in our public policy often does the opposite. This is where behavioral insights come in. How do we make it easy? How do we make it hard? Well, using lessons from psychology, economics, and other behavioral sciences. In fact, behavioral science was born out of behavioral economics, which was an attempt by economists to explain irrational behavior that does not maximize utility. It's grown since then, in the past 15 years or so, to a broader concept. So what are behavioral insights? They're results, they're trends in the data. They're results from many, many experiments, randomized controlled experiments or trials in the literature. Much of this data comes from studying heuristics or shortcuts that our brain takes to help us with the enormous decision-making load we have every day. So behavioral insights are definitely good descriptors of the human condition. They're useful in informing policy, but they're not predictors of behavior, and they're not a magical solution or a one-size-fits-all remedy. They need to be seen in context themselves. Just quickly, how do we capture or use them? Well, there's many ways. Officially, we need to examine a context specifically and create trials and experiments in that context to understand what's going on. We have some shortcut tools called frameworks, like the EAST framework from the Behavioral Insights team in the UK, that helps categorize or capture broad scope of behavioral insights. So let's apply this really quickly to the face touching problem. How do we make it easy for people not to touch their face? Well, you could put hand sanitizer in strategic locations, a visual cue reminding us that hands are dirty and we don't need, or we could have alternative actions. What if it was appropriate to use your elbow to wipe your face if you have an itch? You can't not have an itch. So maybe that's less risky than your hands. Likewise, how can you make it salient or attractive? How can you capture your system 2 lazy attention? You can use Post-its. I know that when I look at my monitor, I'm always gazing to the left. If I put a Post-it there saying, don't touch your face, it might help. I could have a very powerfully scented hand gel that when I bring my hand close to my face, I smell that hand gel and it reminds me. Likewise, you could wear gloves indoors. Now, of course, this is a prop and I'm not normally working with this, but when my partner came down with a very bad case of flu with lots of the COVID symptoms, and testing was not an option because she wasn't a high priority and she didn't have a fever, so we weren't too concerned, but our doctor was concerned enough to tell us to isolate. So we isolated her in one part of the apartment. I wore gloves during those 2 weeks to remind myself, because when I work, I often touch my face. Partnering up, relying on someone else to call out when you're touching your face can help you make it a social activity. And as Fan also mentioned, you need to know when to deliver a message. when someone's hungry is a bad idea to try to tell them what to do. Great example from probationary hearings in Israel. Famous study showed that by and large, people were convicted more often. Were rejected for parole more often when the judges were hungry. It was just before lunchtime, and they were forgiven much more often and granted parole when judges had just been satiated by lunch. So know your timing. Build plans to mitigate. If-then statements are also called implementation intentions. Tell us what we're going to do automatically in a situation if we get there. If I sit down at my work, I put on my gloves. It no longer is a decision, do I touch my face? I automatically build the cue into my life. We'll talk about those again. So let's quickly talk about a few other COVID dilemmas. Hand washing, of course, by my epidemiological friends and others, is probably higher priority. What if it was more pleasurable to wash your hands? In soaps for children, in Bangladesh, Save the Children did a very interesting study, Iraq, I apologize, where toys were inside the soaps. This was not about COVID, this was just hygiene in general, and they saw a dramatic increase in hand washing by children. Making it salient, making it easy. What if we had visual cues on our doorknobs or elsewhere that reminded us? It engaged our system 2 and overrides our system 1. Oh yeah, I better not touch that without gloves. Example from Bangladesh of foot traffic. This is just having a foot pattern and hand symbols dramatically increased hand washing. Social distancing, very tough. In Ireland, this is the standard communication at first on how to promote social distancing. A recent study by some behavioral scientists, one of whom I studied with, promoted this idea, making it relatable. Instead of generic people sitting at a table, you have real people with a real situation that you can relate to. Suddenly, this gentleman, his decision to ignore his cold is going to have a real impact. And I can relate to that. And I can feel guilt and I can empathize with the people that he's going to be, his granny that he's going to be infecting. Denmark, before more strict lockdown measures, used visual cues at the lake to have people all go around the lake in one direction, so they're not bunching up and compromising social distancing. This isn't logical. No one's explaining the rationale. It's just an arrow, and people will generally follow it because they're quite automatic. Face masks. Yesterday, Mike Pence was criticized, the Vice President of the United States, for going to the Mayo Clinic, where there is a public rule inside the building to wear face masks, and he was the only one not wearing one. This is important and I'm sure my communication colleagues will talk about this as well. The messenger effect is very important. Do you have trust with your audience? Are you consistent? If the messenger delivering a message, hey, you better wear face masks, doesn't, then you're going to be diluting your message and giving the opposite message, actually. Panic buying, how do we reduce it? Big issue. This is a picture from the UK. People stocking up on water, things. If you see empty shelves, you're more likely to want to buy whatever's missing because there's a law of scarcity. This is another behavioral insight coming from lots of studies. That's why Booking.com always says only 2 rooms left, even though that there might be many, many more. So we saw in Rome particularly a very well organized and well-oiled restocking of the supply chain. Which once, after a week, people saw that there was no problem getting toilet paper. They didn't need to panic buy anymore, and it subsided. You could also nudge for good. A nudge is a non-conscious or environmental or other intervention that makes it easier to do the right thing. This example here just augments scarcity. Only 2, only take 2. I want even more than 2 when I see that. However, if you were to change it to, I was unable to find the visual I saw originally, as in one Nordic country did, 1 bottle of water costs $2, 2 bottles of water cost $10. Well, you're probably not going to want to buy 2 bottles. You might come back. This is a way that, if economically viable, you could promote better reduction in panic buying. Spring break. How do we partner with the media? And I'm sure Royston will talk about this. If we're showing always the people that deviate from the rules and not the majority who are compliant, the media is helping promote the problem. And we as the UN need to better engage with the media in order to promote coverage of civic duty and the majority. The social norm is very powerful. Robert Cialdini has a famous study where he showed how dramatic reduction in loss of petrified wood from a national forest and park in the US. Original messaging said, your heritage is being vandalized, people are stealing. This makes it normal. Hey, everyone else is stealing, I guess I can too. They changed the messaging to, thank you for respecting your environment and not stealing. Most people do not steal. And then the stealing went down. So, brutal transition to AMR. What does it got to do with coronavirus? Well, there might be some more parallels than you may think. Quickly, bacteria and other microbes, as you probably know, are no longer responding to treatment in some localized cases. And this treatment includes antibiotics and other antimicrobial drugs. I'm probably running over, so I'll speed up a little bit. The FAO is working across sectors internally, including animal health, food safety, fisheries, land and water, and plant, as also with WHO and other agencies. But similar to the pandemic, at least before coronavirus, we're on the brink of a disaster. Failure of antibiotics will cause dramatic changes and challenges. The common communication has been apocalyptic in the somehow distant future, we're not sure. Now this has proven not to create behavior change. There's something called psychic numbing, championed by Paul Slovich. The bigger the number, the less we care. Similar in environmental or other sectors, we're talking about a ticking time bomb and massive death, but people don't seem to change behavior. So what do we do about it? Well, remember, this has also happened in 2015. Famously now, Bill Gates' TED Talk is being replayed 1 million times on YouTube. He was warning about pandemics in the same way. People didn't take notice then either. So what's FAO doing differently? Well, we're trying to do our standard information dissemination and awareness raising, but taking cues from behavioral science where possible to modify communication and make it more salient or engaging. We're talking about in-depth stakeholder approaches to know our audience, like Fan had mentioned, make sure that we understand the context and the people we're trying to reach. Test or quasi-experimental approaches to nudges at the field level, helping farmers come up with new ways and incentivizing them, making it easier to use fewer antibiotics, and then building a community of practice that might take these prototypes forward. I'll go faster here. And this is an example of 900 across 900 farms in 5 countries. The Fleming Fund supported FAO doing some major ethnographic research. And my colleague Mark Cowdell is shown there giving interviews. And this is informing our approach, understanding our audience. And we understand now, as we discussed, that knowledge or awareness doesn't necessarily translate into behavior. So what we're doing is some experiential learning via farmer field schools, making it social, making people work together and finding solutions together instead of being delivered a training. And trying out some experiments. You might be familiar, if you're male, with the fly in the urinal. Something about it makes us want to target that fly, and it's been very, very powerful. So we're testing these kind of things with disinfection, for example, on the poultry farm. There's some caveats too. Behavioral science isn't a panacea. It doesn't do things all by itself. UK got a lot of pushback for trying a behavioral science approach and then changed course. Sweden is still trying to keep out of lockdown and saying that the deaths happening now in Sweden are the deaths that will happen later when other people come out of lockdown. So the main message is we can't predict behavior with these. We can use them together with communication and other tools to influence behavior. Some rational takeaway messages. Whether we know it or not, FAO is primarily a behavior change organization. Our end goal is changing behaviors. Yet we don't invest a whole lot in knowing how to do behavior change. Appealing to rational decision-making is insufficient, we've learned. This pilot is a good start, but we also need to invest more in tools that address irrational and automatic behavior. Thank you very much.